Hi, I am Dr. Suresh K, consultant aesthetic, plastic and reconstructive surgeon at Medicover Hospitals, Bengaluru. Today we will discuss about gynecomastia. Gynecomastia is basically enlargement of a male breast tissue. It can be seen on one side or on both sides. And what causes it? Basically, it is due to the hormonal imbalance. Males have testosterone predominantly and females have estrogen. But some amount of estrogen is also present in the males. When there is an imbalance between testosterone and the estrogen, we see the enlargement of the breast tissues. It can be seen in infants immediately after birth due to the effect of estrogen of the mother, which is self-limiting. And the most commonly we encounter in the patients who developed gynecomastia during pubertal age. During puberty, because of the changes in the imbalance in the hormones, we see enlargement of the breast tissues. But in most of the patients, it will regress and become normal. But in some people, it stays for a long time. Those are the patients who seek for medical help. Why? Basically, these patients are psychologically and emotionally affected because the social interaction for them will become challenging due to the enlarged breast, and they will have low self-esteem and confidence. So, is it the only hormonal imbalance or any other causes for the gynecomastia? There are rarely some other causes for gynecomastia, like taking of some drugs or taking supplements or steroids, or in some cases it is due to the systemic diseases involving the liver and the kidney. We see enlargement of the breast. When a person with gynecomastia comes to us, we diagnose it with different modalities. Mainly we examine clinically and diagnose it. Sometimes if required, we do ultrasonography. And some patients even complaints of the pain or discharge from the nipple, which is rarely seen. In those patients, immediate medical help is required. Once we diagnose, then we treat the gynecomastia. Basically, the gynecomastia or the breast tissue is made up of two components. One is glandular component, another is fatty component. We will assess which component is larger, and based on that, we decide the surgery. The surgery is done very cosmetically, where we remove the breast tissue through the keyhole incisions through one or two. To remove the fat component, we use liposuction, and to remove the glandular component, we put a small incision just under the areola and we remove the glandular tissue. So, the surgical modality may be only liposuction or glandular excision, or combined surgery is done based on the amount or content of the tissues present in the breast. Thank you.